possible to get testicular implants if you're not satisfied with the size of your own testicles in the first place? And the answer is it absolutely is, and it tends to be a quick and relatively easy surgery. In this video, we're going to talk about the pros and cons of it, and what we usually do for testicular enhancement. So first of all, what types of patients come to me usually for this? So it can be a range. It can be folks, who've lost a testicle for various reasons, obviously, or more commonly in my practice, it's folks who are not satisfied with the size of the testicles. It's not unusual if they were on, for example, testosterone, they could have gotten some shrinkage, or if they've used anabolic steroids perhaps in the past. This very commonly causes this. And typically, the first thing we'll want to know is approximately the size of the testicle that remains. And this is important when we're planning the size of implant we're going to use. In my practice, I like to use these implants. These are soft silicone implants, and patients tend to tolerate them very well, as opposed to the other type of implant, which is a more firm saline-filled implant. I typically use these exclusively as patients tolerate them very well. And so when we're thinking about testicle implants, in my practice, typically how we do it is what we call the 4-pack. So basically, we are going to leave the original testicle behind, because usually, regardless of its size, it may be functioning just fine, and we're going to want to leave it alone. And what we do instead is we put an implant in that is large enough to shield it, so we get a nice aesthetic result. So when you look at the scrotum, you're not seeing a 4-pack, you're seeing two larger testicles. And so typically, we'll want to know the approximate size of the testicle that remains, because this one needs to be at least 75% of that testicle in order to get a nice cosmetic result. So we're not seeing that 4-pack, and we have the 2-pack instead. The 4-pack otherwise has advantages in that we're able to, if for example anything was to ever happen to that testicle or developed a lump, your doctor will be able to examine it. And when you manipulate the scrotum in a certain way, it would be possible to see 4 particular testicles, but usually we don't do that. And usually what you're looking at is the testicles themselves. Now, size. This is super important, obviously. And what we're going to want to know is what's kind of the minimum we can go, because like I said, it's going to have to be 75% the size, or 75% larger, I should say, as compared to the testicle that is already there, and to obscure it properly. So typically, these little testicle implants, there are 5 different sizes, and they go up to 5 centimeters in length is the largest. This is 3.5. So as you can see, they go up to a pretty large size. And that is, on the curve, on the bell curve of distribution of normal testicle size, 5 is really getting it to the top of that. This is oftentimes what we'll use, because a lot of our patients are, thinking, hey, I'm having the surgery anyway, go big or go home. And so we'll typically use, like I said, this is a 3.5. We'll usually use about a 5. Surgery itself is relatively easy. It usually takes under an hour. Patients go to sleep in order to have this surgery. We pop the testicles in. We do dissolvable stitches. Usually it's a few days off work and about 4 weeks off sexual activity, and working out, maybe about 6 weeks off biking or things like that put a lot of pressure down in the area. So this is a relatively quick and easy procedure. I find folks tend to be very satisfied with the results, and especially for folks who are just not happy with the size things are there already, it can really make a nice difference.